OCT, a study of microvascular alteration in glaucomatous and diabetic eyes and their association. Madam, are you a ratified member?
Yes, ma'am. Hello. Good morning to one and all present here. My talk for today is on the topic an OCT angiography study of microvascular alterations in glaucomatous and diabetic eyes. I have nil financial interest. So as we all know, OCT angiography is a novel technique introduced in 2006 which allowed non-invasive visualization of the microvasculature of retina. It's proved to be useful in glaucoma for quantitative assessment of vessel density, capillary perfusion percentage, and flux index. It detects microvascular changes in the superficial and deep vascular layers of retina. Our purpose was to analyze and compare the peripapillary microvascular alterations in glaucomatous eyes in patients with and without diabetes and age-matched healthy eyes using OCT angiography. It was a case-controlled study which was done in age-matched individuals of 40 to 60 years. And the duration was for 6 months. And OCT imaging was done of the optic nerve head, retinal nerve fiber layer, and fovea. And OCT A imaging was done of the peripapillary and foveal region. The scan size of 4.5 into 4.5 mm was taken for the peripapillary area, and the scan size of 6 into 6 mm was taken for the foveal area. Our primary objective was to analyze capillary perfusion percentage and flux index at peripapillary area in glaucomatous eyes with and without diabetes versus age-matched controls. Secondary objectives were to analyze alterations in vessel density at fovea and also to establish relation between diabetes-induced retinal microvascular changes and severity of glaucoma. The participants were broadly divided into cases and controls, cases being participants with glaucoma, further subdivided into without diabetes group and with diabetes group, and controls were participants without glaucoma, further subdivided into without diabetes and with diabetes group. The inclusion criteria was 40 to 60 years of age, normal anterior chamber depth and open angles, best corrected visual acuity of 6/12 or better, and no history of intraocular surgery except cataract in the after first post-operative month. Exclusion criteria were patients with any media opacity including corneal opacity and cataract greater than grade 3, any retinal or macular pathology including diabetic retinopathy changes, systemic illness other than type 2 diabetes mellitus. The results showed capillary perfusion percentage and flux index among study groups. It was reduced in glaucoma with and without diabetes groups as compared to the controls with and without diabetes group. It was maximally reduced in the glaucoma with diabetes group. As the RNFL decreased, the perfusion percentage and the flux index was also seen as decreased in cases glaucoma with and without diabetes group. The vessel density in the foveal avascular zone was maximally reduced in the glaucoma with and without diabetes groups as compared to the control groups. The foveal avascular zone area parameters among study groups did not show any significant reduction in the control groups as compared to the cases. The peripapillary perfusion percentage, flux index, foveal avascular zone area, and foveal vessel density showed reduction in the glaucoma with and without diabetes groups and controls with diabetes groups. There was a positive correlation seen between the RNFL thickness and OCT A parameters, especially in the superior and inferior quadrants. The glaucoma with diabetes group was the maximum area of interest. When a comparison was done between glaucoma with and without diabetes groups, there were no statistically significant differences observed in terms of peripapillary perfusion, flux index, and vessel density at fovea. The strength of our study was it is a novel hypothesis to establish relation between microvascular changes in glaucoma and diabetes. It can provide direction to future research to find an association between glaucoma and diabetes. We had few limitations, such as OCTA parameters were not correlated with the visual field parameters. The duration of diabetes and the severity was not correlated with the OCTA parameters. Sample size in each group was 32 and was relatively smaller. Further longitudinal studies with larger sample size are required to get more insights. The perfused capillary density in the peripapillary region and vessel density in the foveal avascular zone area was significantly reduced in glaucoma patients with diabetes as compared to age-matched controls. Diabetes-induced peripapillary vessel changes have no additional role in augmenting optic nerve head damage in glaucomatous eyes. Thank you.
Question, did you have any exclusion criteria depending on the refractive error?
Yes, sir, the refractive error as such, no, but the best corrected visual acuity should have been
because
6 by 12.
OCT measurements in high myopes.
No, sir, that was not taken into
That can
account.
be a source of error.
Yes,
so
sir.
that is one
Okay,
point.
sir. Okay, sir.
And image quality.
Yes, sir. Image quality, only the scan signal strength of more than 7 by 10 was only taken into account. Thank you.